So the symptoms predominance has led some authors to classify the irritable bowel syndrome patients by their predominant symptoms. So we're talking about the symptoms and we'll be classifying them according to their symptoms that the patients present with. Although these symptoms are variable and patients can present with different stool forms. For example, if they had constipation in the start, it could be that they might have diarrhea in the end. So the symptoms also might keep changing and they're variable. So firstly, if we talk about the subtypes, there are three main subtypes of irritable bowel syndrome depending upon the symptoms. One being irritable bowel syndrome with constipation. So as you all know that it's related to the gastrointestinal tract, so it's a complete haphazard sort of a symptom that can be created. So some of these patients, they are completely specific with the having constipation. The second type is irritable bowel syndrome with diarrhea. So there are some other patients who have diarrhea instead of constipation. And the third type is an unsubtyped irritable bowel syndrome, is that they have a mixed form. The stool form could be a mixed type, or they could either be having constipation and diarrhea. So it's kind of in the middle. So these are the three different types of irritable bowel syndrome. So now we have a scale which is called as the Bristol stool form scale, and it is the classification of subtypes of irritable bowel syndrome. So we'll be talking about those forms in detail. So these are the different types of stool forms. If we talk about them in a scale, so there's type 1, type 2, 3, 4, 5, 6, and 7. So there are total 7 types of the stool forms. So if we talk about the first type, as you can see, the first type is more of a pebble type of an appearance of the stool. So it's usually in patients who are constipated. Type 2 is also having a pebble type form, but it's all united. Third and fourth are usually the normal type of stool forms. 5 is having irregular and different types of shapes. Type 6 and 7 is a little more lighter colored of stool, and it's usually more towards the diarrhea side. So it's more loose stools and it's more watery stools. So now if we come to this graph, it kind of explains to us that what are these types and what kind of subtypes do they come under. So if we talk about one side being the bowel motility, which is hard or lumpy, which in other words could be constipated. And the other side, we have the bowel movements that is loose or watery, which could be diarrhea. And in the middle, it represents if a patient is having both constipated and diarrhea type of stool forms, or it could be on a normal basis. So if we talk about the first type, which is the IBS constipated type, IBS-C is known as the irritable bowel syndrome, which is for the constipated type. So like I mentioned before, that types 1 and 2, they come under this category. As you can see, it could be the type 1 could be the pebble form, and type 2 could be pebble form but slightly united. So this is the form of constipated stool. If we talk about the complete opposite side, which is the IBS-D, which is the irritable bowel syndrome, which is of the diarrhea type. So this is the type 6 and 7. And as I've mentioned before, that type 6 and 7 have more of a loose consistency, more of a watery consistency. In addition to that, you can see that the color is also dull as compared to the normal color of the stool. So this comes under the diarrhea part of the graph. And then in the middle, IBS, irritable bowel syndrome M, which represents the mixed form. So you can see that there is an extreme of the constipated, which is the type 1, and then there's the extreme that is type 6. And this mixed form of graph, they have both the constipated and the diarrhea type of stools. So around 25% of bowel movements is the threshold for the classification. So this gives us an overview of how do these stools really represent, how do they form. And then this helps us in categorizing our patients of irritable bowel syndrome according to these subtypes.